You're watching Baptist Health's Resource Live, where our respected experts bring you timely and practical health and wellness information to improve your family's way of life. We're healthcare that cares. This is Resource Live.
Sleep is vital for our bodies to rest and recharge. And if you're constantly having trouble sleeping, the long-term effects can be much more dangerous than just feeling groggy and grumpy. Hi, everyone. I'm Dr. Jonathan Fialco, Chief Population Health Officer at Baptist Health South Florida, and we're coming to you live from the Baptist Health Newsroom. Understanding the causes and consequences of too little sleep, whether it's from too much stress, an unhealthy diet, or other health problems, can really make a difference. We have today with us two experts from the Baptist Health family to talk about how a lack of sleep and constant stress can affect our well-being. I'd like to welcome Dr. Rachel Arhady, a psychiatrist and the medical director with the Recovery Village at Baptist Health South Florida. Great to have you with us today, Rachel.
Thank you so much for having me. Nice to be here.
And we also have Dr. Harneet Walia, who is the medical director of sleep medicine and continuous improvement from the Miami Cardiac and Vascular Institute. Thanks for being here, Harneet.
Thank you for having me.
For the listeners and viewers, before we dive into today's subject, I want to remind our viewers to, again, send in your questions and any comments throughout the segment. We're here for you and happy to answer any questions you may have. Let's kick it off, Harneet, by asking you a question. We're in a very fast-paced world. People stay up late. They seem to be sleeping less. Is there a real number for the average number of hours someone should be sleeping? What's the recommended sleep amount that we would tell people?
Well, sleep need varies significantly among individuals and across the lifespan. On an average, an adult requires 7 to 9 hours of sleep for optimal daytime functioning. And like you said, in this fast-paced world, many of us are sleep deprived. About 30% of us are obtaining less than 6 hours of sleep, which is a real crisis.
I mean, I certainly find myself, sometimes you work, you eat, you have a little bit to yourself, and I find myself trying to stay up just to feel like I had time. Is that something you encounter and you coach people to recognize that it's okay to go to sleep a little earlier and there might be benefits, which again, we'll allude to further. Do you have those conversations with your patients?
Absolutely. Oftentimes people put sleep on the back burner, and then we have to constantly educate and coach them that sleep is vital for optimal well-being. And once you coach them and tell them the consequences of less sleep, I think they put sleep as a priority.
So part of it's recognition and education.
Absolutely.
Rachel, again, it's a challenging world. It's hard to unplug, de-stress. I find in talking to my patients and myself, sometimes in the middle of the night, thoughts just keep circulating in your head. Can you tell us a little bit about the link between stress and sleep?
Absolutely. So we do know that, increased stress, increased worry can cause sleep deprivation, right? So, and it's difficult for us nowadays to unplug ourselves from the world and say, okay, we're going to get sleep now. So it's really important to have those conversations with everyone. You need to pencil in sleep. We've got everything else regulated. We've got our phones hooked up to everything. Why not just, put a little alarm and say, okay, time to start winding down and go to sleep and unplug from that busy world. We do know that there is definitely a direct link between the amount of stress and stimulation that you get and sleep deprivation.
And that goes both ways. The more stress, the more disrupted your sleep is, the less sleep. Does that impact your stress?
Absolutely. If you're not rested enough, if you don't have that restorative sleep, everything else the next morning is going to be impacted, right? So we're not forming those, concrete, long-term memories, we're not learning, that's when our brain begins to kind of put things together and heal from the day, right? So when we're sleep deprived the next morning, we're not able to do those cognitive functions and figure things out, and we're a little slower. And so that causes more stress through our day.
It's interesting when you have dialogues with people, and I know we all deal in our practices with heavily stressed people because it's so prevalent that there are things you can't control in your stress, right? I say to people, well, you can't just move to an island and sip margaritas, but there are things you can control. So as we go through this, let's start elaborating on the consequences of poor sleep And then, of course, speaking towards techniques to get a better sleep. So following up on that, Harneet, specifically, how can, when people don't get enough sleep, they wake up not feeling their best, how does it affect people physically? What are the physical manifestations of not getting the sleep your body needs?
Yeah, folks feel tired, they feel fatigued, they feel sleepy, there is this malaise, lack of well-being, alongside, like Rachel mentioned, they cannot concentrate, they are inattentive. It can really affect their performance at their work and even at the personal level. So it can have far-reaching consequences.
Do you find when you're talking to a patient who has those symptoms that the individual says, hey, I need a better night's sleep? Or do you find people around them, a spouse or a coworker, say, hey, you need to get this checked out? In other words, are most of the people coming to you self-recognizing that their physical complaints are sleep-related, or it's something pointed out to them by others? Maybe a primary care doctor as well.
It's both ways. So it's either the patient, they may have symptoms such as excessive daytime sleepiness, fatigue, not feeling good, or their caregiver or their bed partner who may bring the patient up to us. And sometimes it's recognized by the healthcare professionals. So there are many ways patient can enter our door.
And you mentioned fatigue and various other lack of concentration, irritability. I mean, these are common things that can be not just in the personal life, but in the work environment as well. Would that be fair to say?
Absolutely.
Yeah. So Rachel, we know, again, a lack of sleep can have effects on mental and physical health. What about too much sleep? Is there something to be alerted to as a concern for an individual or someone whose loved one or coworker is sleeping too much?
Absolutely. So even as little sleep as we get, or the more sleep that we get when we start sleeping, 12 hours, 14 hours, things like that, we start looking at other things as well. You want to make sure that the person, there's nothing organic going on, right? We want to get blood levels checked, make sure, diabetes is not on board, that we're not kind of taking care of. The more we sleep, we're putting ourselves more at risk for cardiovascular illness and diseases, stroke. So too little sleep and too much sleep are both not good for our health. And so we want to find that balance, what works for you best. Because like you said, like Harneet said, absolutely, it affects concentration, it affects body, it affects mind, it affects everything.
And I think the theme that we are continuously promoting in our conversations, and we will to the viewers, is think of sleep as part of your life, as part of your lifestyle. And it's, if your stomach is bothering you, you'll say, oh, I got to get that checked out. If you have a pain somewhere, but we don't think of our sleep habits and our sleep patterns as major components. And obviously, as you guys are elaborating and explaining with expertise, it is. So now let's talk about some things that sleep can affect and what we can do about it. Harneet, people come to you with sleep disturbances, are referred by themselves, by others, etc. Talk about some of the things that you discuss with them. Let's start with nutrition and exercise. How are those things that one can address to improve their sleep habits?
Yeah, first thing we talk about is having a good sleep hygiene, maintaining a very good sleep hygiene. And a big part of it is diet and exercise. So we often tell folks not to have a heavy meal too close to the bedtime, avoid alcohol close to the bedtime because it can disrupt your sleep at the later part of the night, avoiding caffeine after lunch hours because it has a long half-life and can disrupt the sleep. And also exercise is helpful in promoting good sleep. There are studies to show that folks who exercise, and particularly do aerobic exercise, are able to fall asleep quickly, have a better sleep quality. We do discourage them to not exercise close to the bedtime because that can disrupt sleep. But diet and exercise can play a good role.
So avoiding caffeine would be a more common one that you see.
Mm-hmm.
Alcohol, follow up on alcohol. You said it quite well, which is alcohol can disrupt the later sleep. But people think, oh, I need some alcohol and wine, it'll help me sleep. Mm-hmm. Elaborate on that a little bit, why that's not necessarily true.
Alcohol initially can promote sleep. It does have those sedative properties, but as we go later in the night, later in the sleep, it does tend to disrupt the sleep. It causes sleep fragmentation. You get these bad dreams and so forth.
So the quality of your sleep is just as important as the quantity, the number of hours, and alcohol can promote a poor quality sleep as well as wake you up. And again, I think that's important for the viewers because it's kind of contrary to what perception is, which is it makes you sleepy and you crash. Back to mental health, Rachel. Again, let's talk about some of the more common mental health disturbances that you're seeing, some of which may be exacerbated with the whole COVID pandemic. And again, where you bring sleep in both as a cause, poor sleep as a cause, and perhaps good sleep as a mitigator of certain mental health conditions.
Absolutely. So, by the time a patient comes to see me, they've already been dealing with these issues for quite a while, right? So as being a psychiatrist, I'm not really the physician people want to see. So unfortunately, what I have been seeing, especially with the pandemic, are alcohol use disorders are increasing, and they were increasing because there's too much stress and I can't sleep. And so a lot of my patients that I've been seeing are getting into this, well, I'm trying to self-medicate because I'm not sleeping. And so they were kind of putting things in our body that are quite toxic and we shouldn't be doing, right? And so it's really asking those important questions, right? What are you doing? Why are you doing it? How often are you doing it, right? So it's important to find out why they're sleeping so much, why they're not sleeping, right? So we have patients that have a lot of trauma that are having nightmares, and that's why they're not sleeping, right? Or we have patients who just don't want to deal with their family, or you don't want to deal with the day. They're too stressed, so they spend all day in bed, all day sleeping. And so you really want to make sure you're asking those important mental health questions. What's causing what?
So let me follow up on that, and I'm going to ask the same question to Harneet. You mentioned people kind of self-medicating, looking for alcohol or sometimes other potentially dangerous substances to help either their stress and or their sleep. Is there a role for over-the-counter preparations to help people sleep? Are there prescription medications? And I think it's fair to say we don't want them first line. We want the proper sleep hygiene first. But in your experiences, your practice, what do you tell people who say, can't you just give me a pill to fall asleep? Rachel, I'm asking you first. I'm sorry.
Okay. We live in a world where we need that gratification right away, right? We've got these amazing computers in our hands all day, which are kind of work like phones, but we can kind of press a button and have things delivered and things happen right away. So we want that quick fix. We want that pill first. What I try to do in my clinic, and from what I've heard of Harneet and what she's saying, really try to teach that sleep hygiene, the good, restorative, helpful sleep, having a schedule. And so having this very healthy lifestyle of trying to get in a little bit of exercise, eating right, and making sure that we're practicing sleep hygiene is really important for patients.
Is that something you would echo, Harneet? Or again, I'm coming to you. Just give me a pill. I just want to sleep. How would you respond to that if a patient were to start the conversation that way?
No, I would go to the root cause of the issue. Why are they not able to sleep? So there are many times there are reasons why folks are not able to sleep. It's either the stress, or they may have underlying sleep disorders such as sleep apnea or restless leg syndrome. And even if they have pure insomnia, which is difficulty sleeping, difficulty falling asleep, maintaining sleep, waking up early in the morning despite getting right opportunity to sleep, the first line treatment is often not medications. It's often what we call it cognitive behavioral therapy for insomnia, which is focused on restructuring those negative emotions or cognitive emotions that are linked with sleep. So that's our first line treatment. We generally do not recommend taking over-the-counter medications. They may have long half-life. They may stay in the body for a long time. They may promote grogginess, and in turn may be actually perpetuating trouble sleeping.
So some of our lifestyle might just prohibit people from getting enough sleep because they're going to sleep late, waking up. The increased stress environment might make it difficult to fall asleep or stay asleep. Certain things that someone may do in their lifestyle, caffeine late in the day, alcohol, may disrupt their sleep. And then again, for those that just can't fall asleep, you would work with them on the causes of that rather than just throw pills at the problem right away, which is exactly the point. Okay. Harneet, are there warning signs of sleep deprivation? Are there things that we would want people to say? Maybe they don't get up in the morning and say, wow, I'm sleep deprived, but little things that we want to promote them to say, wait a minute, maybe you're developing a sleep disturbance.
Yeah, I mean, sleep deprivation is two kinds. One is acute sleep deprivation, where folks may or may not recognize that they are either sleepy during the day, they are tired during the day, and that is because they were not able to sleep well in the night. Either it's because of the short sleep duration or bad sleep quality. And then there is this cumulative sleep deprivation that many times often get under-recognized and under-treated. And many times you have to really hone in the history of asking what time they're going to bed during the weekdays, during the weekends, how much sleep they're getting, and questions about their quality of sleep. So essentially, it's the symptoms such as daytime sleepiness, fatigue, impaired concentration, not able to work well, and so forth.
Now it's probably fair for someone or anyone to have a few days or a short period where that may occur for whatever circumstances. Is there just a idea as to when someone should seek help for it, and where should they seek the help?
Well, if they have persistent difficulty sleeping and they're feeling tired and sleepy despite obtaining 7 to 8 hours of sleep in the night, or they're snoring and they're bothering their bed partner, or they're constantly feeling tired and sleepy, that is the time to seek medical attention.
And again, primary care doctor, for an example, would be a great first step.
Absolutely.
We've mentioned a couple of times proper sleep hygiene. Rachel, can you get into that with a little more detail? What are the kind of specific things that a person could do to ensure a better quality and quantity of sleep?
Absolutely. So, sleep hygiene can include, you can go online and find 20 different things that you can do to improve sleep hygiene. But what it actually means is just having a better sleep routine, right? So just kind of cleaning up that sleep. About half an hour before bed, an hour before bed, kind of shut things down, put your phone away, kind of relax, and you're kind of telling your body, all right, it's time to rest. Keeping a schedule of sleep. So life happens, right? And so a lot of us can't necessarily always go to bed at 9:02 at night or whatever, right? So keeping a schedule as close as possible, making sure that you're going to bed around the same time, even on weekends, you're getting up around the same time as well. Having a nice routine, you can do a little meditation, take a shower, a bath, do a facial, whatever it is that you do to prepare and get your body ready to relax and sleep. And remember, bed is sanctuary. So really the only two things that should be happening in bed are the two S's, right? Sleep and sex. We should not be on our phone in bed. We should not be writing a book in bed. We should not really be watching TV in bed, even though I know that it's kind of hard, everyone wants a TV in their room. But really, if you focus on cleaning up that sleep, and knowing that good restorative sleep is really going to take you a long way, and it's going to improve your mood, improve your processing, improve memory. We really got to put a little more focus into our sleep because it does have long-term benefits for us.
I mean, how pervasive is that? How pervasive is that phone? I mean, I actually started now keeping my cell phone in a different room, so I can't keep looking to it. I noticed my wife does it all night, keeps looking at the phone, picks something up, whatever, and started making her do it as well. And it's an adjustment. It's actually a positive one for those who can actually try it. But how big a disruptor are screens?
Huge. Nowadays, especially, through the pandemic, everything was on Zoom. So we were on all the time, from the moment we woke up on a Zoom call meeting, seeing patients via Zoom, answering emails at night, because now a lot of us are working from home. And of course, we've got these great little computers in our hands. So it is really difficult to unplug from the day. And if you just keep things, put a time limit. do yourself a favor and disconnect for a moment. And that's really part of a lot of self-care. What we're noticing is increase in stress, increase in anxiety, increase in substance use disorders, because we're not unplugging, we're not doing that self-care that's so necessary. And sleep is self-care.
That's go ahead, Harneet, please.
One additional thing I would like to add is that the blue lights emitted from these electronics can suppress the melatonin, which is supposed to be the dark hormone, the sleep hormone, the night hormone. So more exposure to these electronics is going to suppress that good night's sleep because of the melatonin.
Actually, there's some great questions coming in, so I want to get to them to make sure that the viewers' questions are being answered. But let's jump to one of them right now, which is melatonin. And the question is taking it okay? Is it addictive? So maybe, Harneet, if you could elaborate a little bit more about the role of melatonin and what melatonin supplements can and cannot do.
Yeah, like you mentioned, John, melatonin is a supplement. It's not really a sleep aid. So there are lots of formulations of melatonin. It comes at different dosages. It comes at different formulations. So one has to be really cognizant of what formulation you're taking. I mean, overall, melatonin has not been shown to improve sleep. It's generally safe, but it really doesn't improve sleep. It is more to shift your sleep timings. For instance, if you are somebody who is a night owl, so that's when the melatonin is more handy to shift your time from that later sleep periods to an earlier time period. And similarly, if you're a morning lark, that's when the melatonin will come in to shift your time from the earlier time to the later times. That's where melatonin is most effective.
So it's used when people have to travel across time zones to maybe adjust, as you're saying.
Yes.
I mean, I use this analogy, and I'll ask the two sleep experts if I should stop using it. But I would say that, we evolved where twilight was when the sun started going down. Our brain started getting ready for sleep. The sun went down, we went to sleep. And melatonin was kind of being released to kind of prepare the brain for sleep, but light burns it off. So even if you take a melatonin supplement, as you said, you look at the screen, you just burned off whatever it's going to do anyway. So it's the contrary of light versus the melatonin. Is that kind of real? Is that kind of right?
Oh, you said it right. Beautiful, actually. So light is the strongest cue that helps us with our circadian rhythm and with our internal body clock. And both light and melatonin play a role in getting to that dark and day cycle. So, yeah.
Okay, so dim the lights before bed while
Yeah.
that helps.
Oh, absolutely. Yeah.
So again, this is great conversation. Let's go to some of the questions as we see very, very, very good questions coming in. Harneet, I'm going to throw this one at you again. How does aging affect sleep? And I guess the caveat is do we accept this? Do we recommend the same amount of sleep at every stage of life?
Yeah, sleep needs generally decline with advancing age. Most of our older adults, more than 65, require 7 to 8 hours of sleep, and that's based on the National Sleep Foundation guidelines. Now, there are some intrinsic changes that happens to sleep. For instance, they may take a little bit longer to fall asleep, but once they fall asleep, what we call at wake after sleep onset time, that is increased, which means even if they fall asleep, they're more likely to get up and be awake for a little bit time and then go back to sleep. And then there are some other changes that occur, their deep sleep decline, and they're more likely to have what we call morning larks, which means they tend to sleep early and wake up early.
So when both you guys are evaluating a patient who comes to you, do you take into account their age in terms of what you would assess as being appropriate or what you would recommend, or is not a factor in what you review? And what do you think of when you're making your assessments and recommendations?
I mean, age is very important. So some of our sleep disorders become more prevalent with increasing age. For instance, sleep apnea is more common with increasing age because the airway tends to get more floppier. Insomnia tends to be worse with increasing age. And then some of the changes, like I said, intrinsically happen as just the virtue of advancing age. So we have to keep all those things into account when we are managing a patient.
And Rachel, would you find the same thoughts?
Well, yeah, with each life stage, there are changes. Those that are over 65 and mostly are now retiring. Unfortunately, coming into the 70s, a lot of my patients are losing spouses. So then we're looking at bereavement. And so there are different life stages when it comes to depression and anxiety, when it comes to sleep. So you've really got to take everything into account, everything that's happening to the patient at that moment.
Thank you. Rachel, again, question from a viewer. Is there a link between a history of bad sleep and dementia?
So I don't know if I can really answer that. I don't think there's a direct link, but certainly what we know is that poor sleep, bad sleep, it does affect our cognition. It does affect how we process things. And so we do see, patients that are sleep deprived and those that have, these kind of hypersomnia disorders, right? Processing is a little slower, not as good. I don't know if that necessarily means that there's a link with dementia, but certainly forming some of those short-term memory to long-term memories becomes a little more difficult.
Harneet, I'm going to ask the question as written by the viewer, but I'm going to add a little bit to it at the end. So the question is, as a healthcare worker in the ICU, does constant stress increase the chance of developing high blood pressure? And I would ask you to, in the answer, speak to the correlation of sleep and hypertension.
So yeah, great question. So short sleep or insufficient sleep is independently linked with high blood pressure. So one could postulate that having chronic stress causes sleep deprivation or trouble sleeping and can indirectly lead to high blood pressure. And that's because of all those bad inflammatory markers that get released because of the short sleep. And also short sleep is associated with increased weight gain, increased risk of diabetes, and that can indirectly link with high blood pressure. So similarly, there's a very strong association of obstructive sleep apnea, which is a very common sleep disorder manifested by either snoring, difficulty sleeping, or sleep maintenance issues. And that has been linked with elevated blood pressure independently as well.
Do you see in your practice patients with hypertension in whom you assess and treat for sleep apnea or sleep disturbances are able to decrease or even eliminate their blood pressure medications over time?
Yeah, it varies case by case basis. So we know that folks who have recalcitrant or resistant hypertension, the ones who require 3 or more blood pressure pills, and the ones that have sleep apnea, and we put them on the treatment such as positive airway pressure therapy, their blood pressure does decline over a period of time. And many times we have even taken them off the blood pressure pills.
Here's a question I'm going to ask both of you. Is it true that wearing socks at night helps stimulate sleep? Who'd like to handle that first?
Rachel, I'll take that one first. I don't think that there's a direct relationship with socks, but certainly, we look at sleep hygiene as kind of sleep training, right? And so this is kind of what I've done with myself. I'm doing it now with my toddlers. And so, when you have a bedtime routine, you put on a specific pair of pajamas, let's say, and I put on my sleep time pajamas, right? My body is already connected. I know that as soon as I put on those pajamas, it's time to lay down the lights low, lay down, relax, and go to sleep. I don't wear those pajamas to wash dishes. I don't wear those pajamas to play with the kids. So it's kind of a tactile reminder for me, right, that this is sleep time. And it could be for that person. They've gotten used to putting on those pair of socks in order to lay down and relax and go to sleep. So it's just another cue, another thing that they can add to help them relax at night.
So Harneet, do you want to, in seriousness, add to that the best sleep environment? Do you take, 72-degree room or use a blanket to give you that comfort? Do you get to that level of detail?
Yes. It's very important that the sleep environment should be conducive to sleep. We should maintain a cool, calm, dark environment. So like you mentioned, 70 degrees or so, it does promote good sleep. So those are important factors as well.
Well, this has been great, guys. I mean, I on my own, just ask you a bunch of questions for my own education, but in the interest of time, I'll just ask each of you anything you want to add that we didn't address or anything you want to emphasize that we did address. Rachel, any final comments or thoughts?
So absolutely. People ask, how am I supposed to change, 20 things in order to go to sleep? And that doesn't make any sense to me either. But taking 1 or 2 things, and making small changes at a time can help you improve your sleep over time. And I know that everyone wants to try to do things naturally. They don't, some people don't want to take medication for sleep, but, these are behavioral modifications that are really going to take you through a lifetime. And so making 1 or 2 small changes a month, and you'll see over time, remember, this is not a quick fix. These are lifestyle modifications that are very beneficial in the end.
Harneet, similarly, final comments, anything we want to add?
Yeah, I agree. When we say lifestyle modification, we always talk about diet and exercise. So I just want our new viewers to know that sleep should be a priority. And when we're talking about diet and exercise, we should be talking about sleep in the same token.
Thanks, guys. I mean, obviously your expertise and passion comes through in the conversation, and we're all very fortunate to have you as resources within our system. Remember, viewers, you can connect with us on all our social media channels. That's Facebook, LinkedIn, Instagram, Twitter, and check out our resource blog for the latest news at baptisthealth.net/news. You'll find a link there for the episodes of the Baptist Health Podcast as well. On behalf of everyone at Baptist Health, we ask you to please stay safe and say yes to the COVID-19 vaccine.
Find additional valuable health and wellness information on our resource blog at baptisthealth.net/news. And be sure to interact with us on our social media channels for live and upcoming events. Resource Live is brought to you by Baptist Health South Florida, healthcare that cares.